The overhead press is the second of the upper body push exercises that we will discuss within this module. It can be defined as our vertical upper body push exercise. As this exercise is performed in a standing position, it is necessary for the body to maintain control from the feet up and seize many stabilizing muscles in action throughout. Maintaining proper technique is particularly important with this movement pattern. Much like all the exercises we are discussing, there are many different variations that will slightly change the muscle activation. But for the purpose of this module, we will look at the strict overhead press, also known as the military press. The primary muscle used in the overhead press is the anterior deltoid. The deltoid muscle group encompasses the anterior delt, middle delt, and posterior delt. As mentioned, the anterior deltoid is mainly used when flexing the arm at the shoulder or raising your arms out in front of you all the way overhead. The middle deltoid, also known as the lateral deltoid, contracts to abduct the arm laterally as well as assist the anterior deltoid movements. The posterior deltoid, also known as the rear delt, assist in moving the arm backwards into a retraction-type movement. Think of exercises like face pulls and imagine the muscle bulk on the posterior aspect of the shoulder. The middle or lateral delt, the triceps brachii, and the pectorals are the synergist muscles within the overhead press movement. These muscles assist the anterior delt in completing the exercise effectively and will gain benefits with progressive overload of the movement. The triceps brachii is a large, thick muscle on the posterior aspect of the upper arm. It gets its name due to its three muscle heads or points of origin: the medial head, the lateral head, and the long head. The triceps' main function is extension of the elbow joint. As briefly mentioned above, the overhead press requires the body to use stabilizing muscles throughout the whole body, including the upper and lower body. The list is extensive. The main stabilizer muscles to mention are the stabilizers of the shoulder joint itself, and they are the trapezius and rotator cuff muscles.